Hello. Are you thinking about getting breast implants, but you're worried that they might not be safe and they might affect your health? I'm Dr. Aniketh Venkataram from the Venkat Center Bangalore, and today we will talk about breast implants. So, what are breast implants? Breast implants are basically an artificial material that is used to enhance the size of a breast. This is done for women who are looking to improve their self-esteem. Now, implants before used to be like these bags that were filled with salt water. These were known as saline implants. They did not last very long. They would rupture very easily and all the water would come out, which is why they lost popularity, and then came what are known as silicone implants. Silicone implants, as you might be knowing, were filled with a substance known as silicone, which was like a gel-like substance. These silicone implants went through various modifications, and finally these are the latest generation of silicone implants. You can see they are like almost like a gummy bear consistency. They're very soft, supple. They resemble the texture of a normal breast, and they are very cohesive. What that means is even if they break, they do not spill out. There is no liquid inside. So these implants have been quite revolutionary and have in fact greatly enhanced the safety profile of this surgery. So what is this procedure like? Before surgery, the doctor and the patient sit together and they discuss what the patient's aims are. The doctor takes measurements and decides what size of breast implant would be best for the particular patient. Oftentimes you have patients who want very large implants which might not be the best thing for their body. When you have very large breast implants, those can have complications. They can sag over time, they can look artificial, and they can really affect the natural quality of your breast tissue, which is why it's important that you find a doctor who counsels you properly on what size implants would be ideal for you. Once you decide to take the plunge, the surgery itself is a daycare procedure. You come, get it done, go home the same day. There's no admission. The surgery is done through a small incision below your breast or around your nipple. These incisions are very well hidden. They are like around 3 centimeters wide and they're hardly noticeable. Then a pocket is made below your muscle and the implants are placed over there. They're placed in a natural manner so that they do not look fake or artificial. As I said, you go home the same day and you can be back to work within a couple of days. This is known as rapid recovery breast augmentation. This was founded by my mentor, Dr. Bill Adams in Dallas, Texas. So that's what the surgery is like. Now, obviously, the next big question is, are implants safe? Are they going to affect my health in the long term? Well, the first thing I need to tell you is that by and large, they are safe. What I mean by this is if someone promises you that once you've had a breast implant surgery, you will never have to have another surgery again, that might not necessarily be true. Oftentimes, many patients, they feel like they want to get their implants changed out after many, many years. That is something which can happen. Sometimes the implant can rupture. As I said, this implant can break or rupture if there's a lot of trauma or if they get old. But the good thing is even if that happens, the implant does not leak out. So it is not really dangerous, but that would be one reason why the implant might have to be changed. So even with these silicone implants, after 15, 20 years, there is a chance that you might want to have them changed out. So that is the first thing. Now, regarding complications, the worst thing which can happen to an implant is if it gets infected. This usually happens in the early post-op of the procedure. If it happens, the implant has to come out. It's as simple as that. But thankfully, the incidence of this happening is very, very low. We take all sorts of precautions to prevent this from happening. The second complication that you need to watch out for is something known as capsular contracture. What this means is whenever we put any foreign material in our body builds a capsule around it to kind of wall it off. This happens with any implant anywhere in the body. Now with breast implants, it's important that this capsule is not too thick. When it becomes too thick, that's when it starts feeling hard. And in some cases, it can even be visible from the outside. Again, there are various things that need to be done to prevent this from happening. This is again a method of study by Dr. Bill Adams, and he and I are writing a paper on this subject. And we take a lot of precautions. These are all formulated by him. It is known as the 14-point plan, which helps prevent this capsular contracture from developing. So the chance of this happening is very, very low, less than 1%. And finally, the other big thing that people are scared about is, can breast implants cause cancer? Well, there are two parts to this. The first thing that people are afraid of is that can it cause breast cancer? The answer to this is quite frankly, no. As per the available evidence, there is no evidence that any implant has ever caused breast cancer. There is a certain worry that implants might affect your ability to detect cancer earlier. But when you place the implants below the muscle, the chance of this happening is also non-existent because there's a clear muscle in between your breast tissue and your implant. Secondly, the other thing that people are afraid of is a new phenomenon known as ALCL, called anaplastic large cell lymphoma. This is a low grade of blood cancer that has been found with certain kinds of implants. There's a specific kind of implant with a surface known as a textured surface. These implants by some companies have been found to be associated with this kind of cancer. However, there's another type of implant known as a smooth implant, where the surface of an implant is completely smooth. So this is an example of a textured implant, which I took out from a patient because she was worried about this ALCL, and we replaced them with smooth implants. Smooth implants have never been found to be associated with this kind of ALCL, and they are completely safe. And those are the only implants we use in our practice. So these are some of the overviews and to clear up the facts and myths regarding breast implants. There is a lot of misinformation and misconception out there. One other question people commonly ask is, why do we need implants at all? Why can't we put fat and do fat grafting? Well, unfortunately, fat grafting to the breast is still not yet at the level that it can replace implants. They cannot give you the same volume that an implant does, and more importantly, they cannot give you the same projection that an implant does. Secondly, fat when injected into the breast can definitely affect your ability to pick up breast cancer much more than an implant does. The fat globules sometimes can appear like breast cancer in an MRI, and this is also another downside. So it is possible in the future that fat grafting might evolve to the level where they can replace implants, but as of now, the best option for breast augmentation still remains breast implants. And when they are done correctly, the correct implants are chosen, the correct size of the implants are chosen, and they're done with all precautions in place to prevent infection and capsular contracture. They are a very safe and effective surgery and leave a lot of women with a lot more self-esteem and who are very happy that they underwent the surgery. So these are some of my thoughts on this topic. If you have any questions, do feel free to get in touch with us. Thank you.
If you like this video, do hit the like button and subscribe to our channel. Press the bell icon to be notified about new videos.